Hi, my name is Renato. Welcome to my channel. In this video, I will explain you how to use your TAJ card. This means your social security card. I will explain you also how the health insurance or the healthcare system works here in Hungary. And before I continue with the topics of the video, let me explain you that for you to have a TAJ card or for you to receive social security card here in Hungary, you will need to be working and paying taxes already officially. If you're not working yet, you will not have a TAJ card. You cannot get a TAJ card. For example, let me give you an example. You have the family reunification residence permit in Hungary and you are not yet working. You will not get the TAJ card and you will not be able to get public health care in Hungary while you're not working yet. So I wanted to make that clear before I continue with the topic. Let me show you in the screen what are the topics that I will cover in the video. So your starting point whenever you need medical attention in Hungary is the házi orvosi rendelő. Ház means house, orvos means doctor, and rendelő means clinic. Yeah, this is your starting point for the 99% of the cases. Whenever you need medical attention, you always need to come here. And this one specifically is in the 6th district of Budapest. This is an example of another general practitioner or family physician clinic in the 5th district of Budapest. This doesn't have like a very visible name or title in the door, but it is one, and you can find it in Google Maps. In the 5th district, in a street called HOLD. This is yet another example, the last example that I wanted to show you. This is in the 7th district of Budapest, very close to the Great Synagogue, in a street that is called Klauzál. And I found it also in Google Maps. So whenever you come to the general practitioner or to the family physician here in this clinic, they will ask you for 4 documents. First of all, you will need to be registered. You will need to be registered, and they will ask you for 4 documents in case you're a foreigner. They will ask you for your passport. They will ask you for your residence permit. They will ask you for your address card or the equivalent, and they will also ask you for the TAJ card. The TAJ card is actually the social security card, so your healthcare insurance card. Without those 4 documents, they might not provide you with medical attention. Yeah. When you come the second time or the third time, when you are already registered, it might be the case that they don't ask you for all the documents. They will only ask you for your residence permit or for your passport. But for the first time, when you are registering yourself in the clinic, they will ask you for all papers. In the case of emergencies, though, you don't need to come here. You need to call 104. And in the case of emergencies, whenever the ambulance comes, wherever you are, they will ask you for the same documents that they ask you here in this clinic. If you don't have them, they will anyway give you the attention. But if you don't have the TAJ card and you have an emergency and they provide you with medical attention, then they will issue an invoice for you at the end of the medical attention where you are or when you are already stable and you can go home. So in the case of emergencies, 104, that's the ambulance here in Hungary. You don't come to this clinic. So how to know which clinic it is assigned to your address? Because Yes, your address will be assigned to a clinic, to a specific clinic, and your address will also be assigned to a specific doctor. So you need to know which one. As a general rule, you cannot go to any clinic and you cannot get attention from any doctor. You will be assigned, depending on your address, to a clinic and to a doctor. And there are three ways that you can find to which clinic your address is assigned. First one is to look in Google Maps. In Google Maps, you will see, if you search for Házi orvosi rendelő, you might find a clinic that is very close to your place. Most probably that will be the one that you need to go, but it might not be the case. So the second way that you might search for the clinic that is assigned to you is to look in the internet. If you don't know Hungarian, you might not find it. If you know Hungarian language, you might find it, and you might be able to know which is the clinic that you need to attend to, depending on your address. Now, the third way should be the easiest one, but not for everybody. But anyway, the best way, I think, is to ask your neighbor. Your neighbor should know which is the clinic assigned to that address where you live. And if you don't know any neighbor, then it might be the time to knock on the door of one of your neighbors to ask for some help. So in the case of medical attention for your kid or for your child, you will not go to the same clinic. You will not go to the clinic of the Házi orvos, which is for adults. You will need to come to the gyermek orvosi rendelő, or the clinic for a kid's doctor, which is a place like this, the one I'm showing you in the video. This is in the 13th district of Budapest. And the procedure to bring your kid here will be very, very similar. So you will need to register your kid depending on your address. And he or she, your kid, will need to bring, or you will need to bring the same personal documents for you to get medical attention. Now, not in all districts and not in all cases, the clinic will be separate to other type of clinics. Sometimes the clinic for the kids doctor or for the pediatrician, they will be in an other or within a hospital or within a clinic with different types of specialist services. So do not get confused by that. So as I told you, the best way to know which clinic you need to attend to, you need to go depending on your address, is always asking your neighbor. The same for a kid's doctor. So if you have a neighbor which has kids, you know a family within your building, you should ask them which is the kid's doctor that you need to attend to. So here you can see the opening hours of this clinic. The opening hours are important, but most importantly are the working hours of every doctor. Now let's assume that your doctor is the second one in this list, which is Ramona Keresztes. If you come on Monday to the doctor to get attention from her, then you need to come from 4 o'clock in the afternoon until 8 o'clock at night. If you come on Monday at 8 in the morning, you will not find her and you will not get medical attention. This is very important. You need to follow the working hours of the doctor that was assigned to you. This is very, very important. On Fridays, here it is an exception. They put here the word változó. Változó means that it changes. So yeah, whenever you need medical attention on a Friday, you might find your doctor here in the clinic, or you might not find him or her. So whenever you go to a clinic, to that clinic that is assigned to your address, you might encounter, you might experience that the doctor or somebody, an assistant, somebody, some staff from that clinic, they're not as friendly, they're not as empathetic, they're not as customer oriented. Try to be patient with them. It might be just because of their personality, but it might be also because of the culture. Here in Hungary, Hungarians in general, as a general rule, they are a little bit serious when they met somebody. When they know already that person, after they know the person for, I don't know, maybe 2 months or maybe 4 months or 6 months, depending on, it depends on each person. They start to get a little bit more friendlier. But whenever they meet somebody for first time, they are a little bit reserved. You might encounter this in the clinic where you attend. Try to be patient. Yeah, that's the only thing I can tell you. It is a different country, so this is also part of the adaptation. Get used to their culture. This is what I can tell you. And I tell you this, I mentioned this in this video because many, depending on where you're from, some foreigners, they say that Hungarians are a little bit serious and they are not as customer oriented. So you might encounter this situation. Don't be surprised and be patient. That's my advice. You might also encounter in some of the clinics that they don't speak English, or if they speak English, they speak not in an advanced level. In that case, you can try to request for a doctor who speaks English. Not every clinic has a doctor who speaks English, so I tell you that from now before you go. But you can request. Sometimes I've heard some cases where there is no doctor English speaker in a certain clinic, and they advise to go to another clinic where there are doctors who speak English. You can try also that. It is not their obligation to do that. As a general rule, you need to go to the doctor where your address is assigned, but you can try to request that you would like a doctor or a clinic where there are doctors who speak English. Now, I would like to explain you a case scenario, a very common case scenario of, whenever you need to go to get medical attention. Let's assume that you have a virus and you have high fever already for 2-3 days. It doesn't go away, so you think that you need to go to get medical attention. So you go to the clinic, and in the clinic they examine you. They do whatever they need to do, and they say, the doctor tells you, the general practitioner tells you, you have this virus, and here is the medicine that you should get. So they give you the paper, and there it is written, the medicine. You go with that paper then to the pharmacy, and in the pharmacy you buy the medicines, you take the medicines, you get cured, and then depending on the type of illness, they might tell you, the doctor, the general practitioner, they might tell you that you should come back for control to see if you are already good. Sometimes they will also tell you to come back when you're already good, when you're already stable, to give you the paper that you need to take to your employer to prove that you were sick. That's a pink paper. It's a paper pink with white color, and some doctors will not give you that paper when you arrive. When you arrive to the clinic and get the prescription, the medical prescription, they will only give it to you after you come back, when you feel already good, just for you to know how is the procedure. So here is an example of a pharmacy in Hungary. I'm showing you the pharmacy just for the sake of showing it to you, but most importantly, you see here the word pharmacy in Hungarian language, which will be more useful when looking for pharmacies in Google Maps. So if you type this word and without choosing any of the suggestions that Google Maps suggests you, you click on search, you will see the closest pharmacies to you, depending on where you are located at that specific moment. I will also explain you a second case scenario where you have a more complex issue or a more complex illness. So let's assume you were playing, I don't know, volleyball, and you feel that, so you broke something, you fell and you feel some pain. The pain doesn't go away. It's already 1 week and the pain is still there. So you think that you need medical attention. So you go to the doctor, to the general practitioner. That will also, they will always be your starting point, as I told you. And the general practitioner cannot do anything with you. They will check very simple things, and then they will give you a paper called beutalo. With the beutalo, you will need to go to a specialist, and the specialist might be in that clinic, but most of the times it will not be on that clinic. You will need to go to another building, to a hospital, and with that paper called beutalo, then you will go to the specialist. The specialist will tell you to go to get an X-ray, for example, and you will need another type of beutalo. This paper is very important whenever you need something that is not the general practitioner. And with that beutalo, you will get X-ray. When you get the results of the X-ray, then you will need to come back to the specialist, and the specialist will let you know what you need to do. What is the treatment for you to get? Medicines or physiotherapy or anything. So it is not as easy as in some countries that you broke your leg and you know which type of specialist you need and you go directly to that specialist. It is not like that. You will always need to start with the general practitioner, and depending on what the general practitioner tells you or decides, you will get the beutalo and then you will go to the specialist. Yeah, this would be the second case scenario. That is all I wanted to explain you in this video. I hope that it was of help for you to get to know how the healthcare system works in Hungary. See you in the next video.